so we've got some considerations we need to make when training special populations. We've got a client with high blood pressure, so we need to make sure that they've got a medical clearance and that they are able to train. With these type of clients, you want to try and avoid elevating their feet, as it puts excessive stress on their heart, and using heavy weights overhead. So that sort of movement would add excessive strain on the heart as well. So your medium intensity cardio is great. So exercise in general is good for this population group. It can really assist with their decreasing their blood pressure. And then we've got a client with lower back issues, so they also need to be cleared before they can work out or train as such. A client with your lower back, they really need to be warm and ensure that they've stretched the muscles out. They also don't want to do exercises such as deadlifts or heavy deadlifts especially. They don't really want to be moving weights around that are very heavy or too heavy. I suppose the best possible outcome here is to try and strengthen it gradually over time. So you could also do a lot of body weight stuff or use machines rather than a heavy barbell. Strengthen and probably just stretch out the back muscles in question there also too. And then you've got a client with a shoulder injury, so you look to limit the amount of use of that shoulder. You'd obviously still want to try and keep a little mobility in it if possible, but if it is quite a serious injury, you can move on to just training the legs and the core. So you'd look to, as I said, limit the shoulder usage throughout the sessions there. Sometimes, if it isn't a super serious shoulder injury, you can do some pressing overhead just to keep it nice and close to the midline. So once you get out away from the midline, it does add extra stress on that shoulder joint. So you obviously just have to assess with the client before trying to build strength back.